made it to chapter 9, Human Body Systems. This is where the vocabulary that you work to learn the whole semester and repetition, all the tactics you use, hopefully will pay off. That's my hope for you. It's a lot of work to get here, and this is where you'll see how the body systems actually work in unison to keep homeostasis working as an organism. So you get to kind of see it on a more macroscopic level as opposed to just learning a bunch of words that at first don't seem to make sense. You see these two quotes here. My life, my story of my life is a Winston Churchill quote, failure to failure, but you don't lose enthusiasm. And that it really comes down to that. And I think the second one is about perspective. You know, is the glass half empty, the glass half full? You've heard of these. If you can alter your perspective, if you can make yourself care about something, it's amazing what you can get done. It's it's bizarre. I'm not saying it doesn't take a lot of work when you really don't want to do something. True, but if you can do that, if you can mentally control that outlook, it's a substantial difference in how you perform. So here we are with the body systems and the objectives. The first objective is we're just going to introduce what are the tissues. So you might have heard some words misused. I'm not going to get too esoteric. You know, technically it's wrong to say lung tissue. Technically it's wrong to say kidney tissue because there's 4 main tissues in the body. And so tissue is a group of cells that do a unified job as a role in the body. And then these 4 tissues make up every organ system. So there really isn't any kidney tissue. It came from the kidney, the organ. So technically that's why they say that. But there's 4 different tissue types in every organ, especially every organ system. You can see a couple of pictures down here on the right of the different systems, and we're going to go through, I don't know, 6 or 7 of these. We combine a few because we're just going to look at how homeostasis is maintained. That's hopefully the foundational level you'll see in each of the systems as we work through it. So I'm hoping that with this image, well, first of all, you see the cross curriculum. So this is David, and you hopefully know who made this sculpture from your humanities class. I won't go any further. What you might want to do, I think it would be beneficial to take a few minutes and just work through these on a scratch paper, pause the video, and try to guess. Try to, the whole KWL. In other words, what do you know, what do you want to learn, and what did you learn at the end? It kind of helps you pay attention as you go through something that you're working to learn. So I'm going to go ahead and get started. You can see this is pointing to the muscular system, skeletal muscle. There's 3 different types. We'll talk about that. Technically, this is the pectoralis. And then you can see these coming down further just to make, this is kind of hard to see. This line looks like it's pointing to the liver. This line looks like it's pointing to the stomach, which is under the liver and behind it. This line's pointing to the pancreas. We're going to go through all the ones we've talked about so far. This one is pointing to the small intestine that looks kind of jumbled. This is pointing to the large intestine. And some of these organs overlap. They belong to a couple of different organ systems. And so I wouldn't ask you something that's going to have multiple answers to it. It would be straightforward. And then you have the cardiovascular system. The line is technically on a vein because it's on the blue one, but you can't always go by colors, especially in the pulmonary circuit. This line, maybe you can guess that bone. Yeah, it's your shin bone, but it's your tibia. And then over here you have your kidneys. They're technically under your rib cage, so they're protected. Looking from the back side, you say the aorta coming down, branching off to the femoral arteries. This is the bladder. You can see the central nervous system with the brain and the spinal cord, and these are the peripheral nerves that run down outside of the spiny process of the vertebra. So here, just to give you some idea how your main trunk of your body is separated. And you're gonna have to know a couple of these words, but not all the words on the slide by the time I show them to you. So the heart in the middle and the lungs are in the thoracic cavity. And the dividing line between the green whatever color you want to call that, the thoracic cavity, and the peritoneal cavity down here is the diaphragm. It's this pink muscle. And when it's cut away at this longitudinal section of the body, you can't really see it. It's very, very thin, but it does cut your body in half, completely in half, from the lungs and the heart, the thoracic cavity, and the peritoneal cavity directly below it. So it really does divide your body in a north and south region, if you will, inferior and superior if you're using anatomy physiology terms. So you heard me say the other cavity, and the other cavity is the peritoneal cavity. Just say peri, like perimeter. It's the entire perimeter. Some people will say abdominal and pelvic, but these aren't divided. There's no dividing line. So this is just all one big bag. If you ever had surgery with trocars where they inflate this with CO2, they put a light in one hole, an air hose in another, I'm not kidding, and then the other hole will be the cutting instrument. And that's how they do a lot of surgeries, because it does blow up like a bag, and also there's less chance of infection as opposed to just opening you up. So know the thoracic cavity. What organs are in the thoracic cavity? The lungs and the heart. So the easy way to remember this is all the organs are in the peritoneal cavity except the lungs and the heart. And then this muscle here is the diaphragm that divides, that actually breathes for you. Remember, the lungs don't breathe. The lungs only diffuse. Diffuse isn't any kind of energy being spent. It's just gases going from higher concentration to lower concentration. The diaphragm is a muscle, and you certainly know it is a muscle when you get hiccups, because that's the diaphragm having spasms. And I have a question here: why would a lining for the heart and lung be important? Well, think about what the lungs and the heart are always doing. They're always moving, and then that builds up a lot of friction. Remember, go back to properties of water, adhesion, cohesion, and you have a little lining of water, very microscopic, along the lung so it can slide in and out of the rib cage. Just put your hands on your ribs, take a big deep breath in, and your lungs moving up and down and rubbing on that rib cage, but the friction's reduced because of the water. And then also those cells, like the pleural lining, would need to be replaced often because of the friction. That's why they have to have a lining, and those cells are epithelial and they're highly mitotic. And you remember that from chapter 6, cell reproduction. So cells that are highly mitotic are going to have to replace themselves often. And those would be your epidermis, your skin, the outer layer, anything that lines something that moves, like your lungs and your heart, and the inside of your intestinal tract, because your food's always going through it and it's abrading it. So here's an application of the peritoneal cavity. So this is peritoneal dialysis. Now dialysis, hopefully you understand, has to do something with the blood, has to do with cleaning the blood. So this is the first form of dialysis that people will get on when their kidneys start to shut down. This is not a fun dialysis, none of them are, but you can see they hang a sterile bag of fluid, it goes in and it dumps into this cavity, and then there's a drainage port. So you're literally rinsing out whatever the kidneys failed and leaked, so to speak, into the peritoneal cavity to help back up the kidney failure. I think it's below 30%, but don't hold me to that. And then hemodialysis, where you go to a DaVita or a dialysis unit, that would be when they put the port in your subclavian vein, or they do it through the arm. But this was just an application of peritoneal dialysis in the peritoneal cavity. They don't call it the abdominal dialysis or abdominal cavity. And one of the reasons why we have to do this, and this is bringing in something that will come up later, is the blood pH. So if your kidneys aren't working well, they're not regulating blood pH. And by this point in the course, you absolutely know why that's critical, because of enzymes denaturing. And if enzymes denature, well, they handle all metabolic processes, so therefore you don't have life. Remember, homeostasis equals metabolism performed by enzymes. It carries out life. And if pH and temperature are off, these are concepts going all the way back to chapter 1, you just cease to exist as an organism. You can't be outside of those homeostasis ranges very much and or for very long. So this is kind of a review. This equation came up in chapter 2. So it does apply here because that's what the kidneys are doing. I went over a mnemonic for the kidneys. The kidneys make PP, and P stands for pressure and pH. A student came up with that. I thought it was pretty clever. So you got the lungs exhaling, controlling the left side, if you remember this, and on the right would be the organ of the kidneys and the urinary system, controlling it on the right. So here we are at the 4 main body tissues. So they're going to be, that's the mnemonic, connective, epithelial, muscle, and nervous. So if you want to use semen as a mnemonic, just don't spell it wrong, because then it won't be very helpful. So what you need to know to help you remember these 4, because all cells are in one of these 4 categories. All the different kinds of cells you can think of in your body are in one of these 4. Connective, admittedly, is pretty hard to remember. It seems like it makes no sense, but if you think about each of the ones that I go over, you'll see in some way they connect something. Epithelial lines something. So think about the thoracic cavity. And we talked about the lining of the heart and the lungs. Well, there you go. Epithelial would line that because they're highly mitotic. So, and then you come down to muscle. Well, why is muscle unique? Well, it contracts, it moves. So just ask yourself, what does muscle do? Well, the smooth muscle in your intestine moves food. The smooth muscle in your vessels moves blood. Your heart, your cardiac moves blood. And then your skeletal muscle moves the skeleton. So if you think about these logically, they're going to be a lot easier to learn. And then nerve is unique because it's the only tissue in the body that can actually generate electricity, can conduct it. And I put MV there because it's millivolts. It's not a volt. That's what's in the wiring in the walls of your house. Millivolt is 1,000th of a volt. Not 1,000 volts, 1,000th. And then we're going to go through these individually. So here's connective. And you can see this. I love the knee. The knee is amazing to me because it's just so unstable. I mean, look at it. It looks like it's just pivoting like a ballerina pivoting on her toes or something. So you might be able to pick out some of the things in this diagram. So the upper bone here is the biggest bone in the body. It's the femur. The bone down here is your shin bone. That's the tibia. The fibula isn't being shown. That's the lateral bone in the lower leg. If this is the femur, this is the front side of the leg. This would be the quadriceps. Back here would be the hamstrings. Back here would be the gastrocnemius. And here's your patella. So it's just an amazing joint. And what they have cut away here are a bunch of ligaments that would suspend it like a suspension bridge, trying to hold this thing together. Now you can kind of see that if someone who plays sports gets hit laterally and gets their knee knocked left or right, there's nothing really there to stabilize it because the main muscles are stabilizing anteriorly and posteriorly, not laterally and medially. So look at all these tissue types. Now these are easier. So you got your dense, this would be like a ligament or a tendon up here. You don't have to know that name. You have to know some of these as examples. Like this you can identify as fat. Adipose tissue is fat tissue. And you might think, how does fat tissue connect things? Well, fat is under your skin. Think of it connecting your skin to your muscle. Even if you're really, really lean, you have a little bit of fat under your skin. And this is bone, and you think, how does that connect it? Well, it connects one bone to another bone. I don't know. Think about it like that. Bones have to touch. They have to touch each other. They connect. This is cartilage. Now, the cartilage here is on the ends of the bones. Bones don't touch bones. That's arthritis, and that's painful. So cartilage is on the end. It's also on your ears and your nose, but it's on the ends of the bones. It's and it actually gives rise to bone. Without cartilage, you don't have bone. Your whole body started as a big squishy pile of cartilage, and then it ossified and became bone. And then also the cartilage became ligaments and tendons, believe it or not. Not muscle. That's a whole different germ layer. And you can see the bursa in there. Blood, you think, well, how can you think of blood as connective tissue? Well, think of when you cut yourself. You want the blood to clot and heal so it's connecting. Be creative, I don't know, but know some examples. And you can see there's a knee moving, and it's kind of neat. It's a video on that, looking at the stability or maybe lack thereof of the knee itself. So here is epithelial. And epithelial tissues are named for their shapes. And you might think, well, I don't really see some clear shapes here. I can hear what you're saying. But again, we're going to try to be creative. So squamous, just think squamous means squished. See how flat these are? And notice the organ system they're in. So squamous tissue is one cell thick. You have 30 squamous tissue linings on the outside of your skin. The epidermis is epithelial. Don't get epidermis and epithelial mixed up. Epithelial is a tissue. Epidermis is part of your integumentary system, which is your skin. And your skin is an organ. Okay, so think about that. Epithelial tissue is part of the epidermis, but it's not all of the skin. Skin is made of all the tissues. So it's very, very thin. It's cheek cell. If you ever did a cheek cell microscope activity in high school, that's what you were looking at. No, it has to be so thin in the lung that the blood can go through it, the junctions, and the blood cells, not the blood go through, but the gases can diffuse through, and the oxygen can go into the blood and the CO2 can come out. So it really is form follows function. Think of a cube. This kind of looks like a cube, a little bit thicker than squamous, in the kidneys. Most people think of kidneys as filtering. You got to get that out of your mind. Kidneys are so much more advanced than that. They clean your blood chemically. So advanced that we can't even emulate them. We can't even make a kidney. And remember, kidneys make PP. What do they control? pH and pressure. And here are the other three. There's 20 different, at least, epithelial tissues. I'm just looking at basic areas of the body so you can understand their functions. So here's the small intestine. When we get to the digestive system, you're going to find out that the small intestine's job is not to digest. You're going to get some things out of this chapter that you're going to have to work at rearranging your misconceptions. Because, for instance, like when I talked about lungs and the diaphragm, most students would think, well, the lungs breathe, but they don't breathe. Breathe is a verb, and it implies energy being spent. And the lungs are just a bag of alveoli, so they just diffuse. They don't spend any energy. They're just there. What breathes is a diaphragm. So for the intestines, most people think that the intestines digest. They do not digest. They are an area of absorption. All they can do is absorb. What do you think? What is the chemical? What is the protein that allows for catabolic and anabolic reactions? Enzymes. Enzymes digest. But the small intestine and large intestine are areas of reabsorption of different nutrients, and we'll get to that in the digestive system. So these cells, these epithelial cells, they kind of look tall and skinny. They call them columnar. They look like a column. And then you look at the one here, and this is your trachea, and this is your esophagus. The trachea is in front of the esophagus. And this one has little hairs on it, because think about when you're really sick and you're hacking up mucus from your lungs, you want that to kind of sweep up and out. So these are ciliated columnar in your trachea. And that's what's being paralyzed when people smoke or vape. That's why you can't stop coughing. Because when you cough, you're supposed to project it up, and then the cilia hold it, and then you project it further with the next cough. But when you paralyze the cilia, the goop of whatever it is just keeps falling back down in the bottom of your lungs. And then for the esophagus, this is pure muscle tissue, but it does have the outer layer is epithelial and the inner layer is epithelial to allow it to be stretchy. Because did you ever swallow something wrong and it goes down and it hurts? It's because it's stretching it in an awkward way. And then peristalsis kicks in, which is a muscle contraction, and pushes it down, kind of like as you squeeze out toothpaste. And that's rhythmic, and it's the autonomic nervous system, and you can't turn that off. And you're wishing you could stop it from working at some point, but when something's hurting, but you'll find it just keeps going until it moves on to the next spot. So we have squamous, cuboidal, columnar, ciliated columnar, and stratified squamous. So your skin is stratified squamous. There's other tissues in it, but you can pinch your skin, pull it away, and let it go back. And that's the stretchy part, this basal layer here that stretches out. We covered that. And now we're into muscle tissue. So we're just kind of superficially going over the 4 different tissues, C-E-M-N. And now we're on the third one, which is M, muscle. So the basics for this, we're going to look at muscle more as it moves the skeleton. But for here, know the 3 types. You can look at these pictures and clearly see a difference if you look at them long enough. Well, the first one's real easy. It's very geometric. It's got those striations in it. And then this one's kind of globular and amorphous. And then this one is similar to the middle one, but it has these intercalated discs, these dark bands. And that is for the nervous system to keep this one beating regularly. So you can probably start to guess which one's which. So you want this to beat regularly. So the last one here is cardiac. The middle one is smooth, and the first one is skeletal. Okay, so think about how you're going to remember those. The pictures are pretty clear. It's just kind of sticking in your mind what's going to nail that for you so you don't miss the recall on that. And you can see the names are here really light, hardly any contrast. My apologies. But you have skeletal, smooth, and cardiac. So again, think about what they move. Skeletal moves the skeleton. Smooth, think of smooth move X-lax. That was a put down we had for someone that would do something stupid and fall down when we were kids. Don't ask me. But smooth move means a good bowel movement. Get it? So intestines. So smooth muscle will move food in the intestinal tract, and it can move blood in blood vessels. But what really moves the blood is this one, and that's cardiac. And yeah, intercalated discs. Just know that cardiac tissue has that extra nervous tissue in it. And we're on to nervous tissue. So nervous tissue is unique, as we learned, because it conducts, doesn't just carry it, it makes electricity at a millivolt level, and then it propagates that and sends that on to either another nerve or to muscle. So there are some really good videos here that can help you through this. I really encourage you, especially in this chapter, to open up the PowerPoint so you have access to those videos. Again, you have to download them, open them from your device, and then open them in full slideshow mode to be able to click on the videos and go through those. So there's 4 parts I want you to know as we go through the nerve tissue. There, you can see a ton of names on here, but you don't have to know all those. Okay, so the tentacles are the dendrites, cell body with the nucleus, axon with the insulation, that myelin sheath, and then the synapse is the switch. It's the gap in between a nerve to a nerve or a nerve to a muscle. You don't have to know the other names in here. So going back to chapter 2, what's an ion? Remember ionic bond? Sodium chloride. So sodium, chloride, calcium, magnesium, iron. These are a couple of them, and you're going to have to know some of these and their jobs and the roles that they perform. So sodium, we're not going to really talk about chloride in the nervous system, even though it plays a big role. We're going to talk about sodium and calcium. Because inside a nerve, it's very, very negatively charged. Think about this. Definitely read this over in the book slowly and make sure you get it. It's very negative inside the nerve, negatively charged because of proteins, which are negatively charged, and because of ATP, which is negatively charged, has a negative phosphate group. You don't have to know any more than that. So we're going to work with why does the sodium and why does the calcium want to come into the nerve, and you're probably already starting to get it because it's negative inside the nerve. It's drawn there, opposites attract. So calcium is necessary for nerve, and we're going to get to specifically in a second here. It's very specific to nerve because you need calcium to send a neurotransmitter into the synapse. Okay, so play that back if you have to. You also need calcium to clot blood, and you also need calcium to allow a muscle to contract, which we're going to get to. So very, very important. Most people, if you ask them why they need calcium, they'll say, oh, you need it for your bones and teeth. And you got to get that right out of your head. So we need calcium because of these three things. Put a neurotransmitter in a synapse for a nerve, allow myosin to grab actin in a muscle for muscle contraction, and third, for blood clotting. Three very vital functions in the body. So remember electrolytes, remember polarity. I had a picture of a battery back in chapter 2. So make sure you understand that iron I mentioned, but I think by now you know why you need iron. And iron is on the hemoglobin of a red blood cell to carry oxygen. It's not necessarily a big player when it comes to an action potential or a nerve stimulus, nerve impulse in a nerve. So here we go. The four major functions here. So first of all, this is a nerve, even though it doesn't look like one. So it's got all the organelles, it's got the plasma membrane, phospholipid bilayer. I know it doesn't look at it, but you got to get back in your head that this is a normal cell. The only difference is it can conduct electricity. So a stimulus will happen in the dendrite. So the first thing is a stimulus has to happen. If it's your eyes, light hits your retina. That's a stimulus. If it's your nerve cells in your skin feeling temperature or pressure, something touches you or the temperature changes. In your ears, molecules of air vibrate and they strike your tympanic membrane, which hits the three bones in your ear. That hits the cochlear nerve, vestibular cochlear nerve. You don't have to know that. And then that stimulates the nerve. So no matter what, it doesn't matter what it is. It can be a thought. I want to move my leg. And then that thought is a stimulus, and that stimulates the nerve, which then stimulates the muscle. So you have to have a stimulus. So at the dendrite, number one is a stimulus. The stimulus, we're going to skip over the details of it, just that it goes around the phospholipid bilayer, around the cell body, and winds up at the axon. So every time something moves in here, it's like a game of mousetrap or dominoes. It's going to cause something else to move. So it's like a series of switches, if you will. So once that stimulus comes through the dendrite around the cell body, it's going to hit a protein channel, and it's going to knock it open. And that protein channel is sodium protein channel. So it's shut. So this nerve is not working right now, and it's shut. When that stimulus hits that protein channel, it's going to open, and sodium is going to be all around out here, outside the cell. And it's just going to naturally diffuse in because it's pulled in because of the negatively charged area in the nerve. So the stimulus is going to knock open the sodium protein channel. Sodium's going to move in, and then sodium's going to go in and out and in and out all the way down this axon. That's the action potential. And every time it moves, it's going to hit another channel open, hit another channel open, hit another channel open. And when it gets down near the end, this presynapse area, it's going to knock open a different protein channel. And what do you think that is? The calcium protein channel. So the calcium protein channel is going to get knocked open by the action potential from sodium, and then calcium is going to move in. Well, calcium has a very unique job. It's going to flow into this presynaptic cleft. Once the channel opens, it'll flow in. It's drawn in by the negative charge, and then it will knock, the only thing that can do this, calcium will knock a neurotransmitter into the synapse. And there you have it. So stimulus flows around, knocks open the sodium channel, sodium rushes in because it's negative inside, and it goes all the way down, this action potential goes all the way down the axon, kicking open protein channels till it gets to the end here, and then it will knock open the calcium channel. Calcium moves in, and calcium's job once it comes in is to kick a neurotransmitter vesicle into the synapse so that the next nerve or the muscle or something else can be stimulated. And it's just a matter of keeping them straight and thinking through logically, why did the sodium come in? Why did the calcium come in? What did the calcium do that was different than the sodium? Know them in order. Another thing you can think about is sodium channel blockers. So if you've ever gone to the dentist and had lidocaine, so they inject lidocaine into your gum with a little bit of epinephrine, Epinephrine will constrict blood flow so it can't leave, and then the lidocaine will block this sodium channel, and so the pain's happening, you're not able to feel it. And until that wears off, if the dentist did their job right, everything will be fixed. You won't have any pain other than that pressure from all the work that was done, hopefully. So what unit is electricity measured in? For the nerve, remember, it's millivolts. It's in the whole body in millivolts. And you know that because of EKGs and EEGs, electroencephalograms, that's of the brain, and EKGs, cardio, they spell it with a K within German, so you don't get them confused, for the heart. For the heart. And if you're interested, here are some diagrams of how drugs can act on the nerve itself. So dopamine is your instantaneous, it's the neurotransmitter that really leads to addictions. And we're born to be addicted. We can become addicted to lying. We can become addicted to something that you might think is, not a big deal. But dopamine is like instant gratification. Serotonin is more of the joy neurotransmitter. Down the road, delaying gratification, developing good habits over time, opportunity costs. I mentioned that earlier in the class. You're sitting in a classroom or watching video lessons because you know down the road this is going to benefit you, whether it's just a degree, depending on your outlook, or the knowledge itself. So those are kind of in a nutshell the two main differences between dopamine and serotonin. Dopamine is instant gratification. Serotonin is for people who are, it's more for that being able to delay gratification. So in this is meth, and it's showing you how meth acts on the synapse and keeps that dopamine there. Having it stay in the synapse for a longer time brings on a sense of euphoria. Obviously, there's a bunch of negative consequences for that because you can burn out the dopamine producing cells, or you can burn out the receptors. Heroin's a little bit different in the fact that it's a GABA inhibitor, and it erases all pain, physical pain, emotional pain, and it also plays a role with the dopamine, but it acts in a different way as it interacts with a neurotransmitter called GABA as well. And then you have cocaine, which is going to be not allow the dopamine and sometimes depending to be reabsorbed into the actual nerve itself. So it will make the dopamine stay in the synapse longer, and that can cause damage to the actual receptors. And when those receptors are permanently damaged, that's when addiction comes around. If you won't be able to feel as good as you once did with or without the drug, no matter what, because now the receptors are damaged. And here is acetylcholine, is another neurotransmitter. You don't have to know this one. I just put this slide up here for if you're interested in looking at some of the different, how it affects acetylcholine and how they work as a toxin or a venom. You can kind of go around here, pause the video. And this is the last slide for part 1 of chapter 9. And this is trying to help you understand that the 4 tissues aren't just in one area. So this is the organ known as the skin. It's the largest organ in the body. And if you look at this diagram, hopefully you'll pause the video and try to pick out at least the 4 main tissues, different examples of the 4 main tissues, just in this small segment of the integumentary system, which is the skin. And so go ahead and pause it, and then I'm going to start going over them now so you can kind of pick them out. So up at the top here, you have epithelial. This is squamous on the very top. You have stratified squamous epithelial underneath, and even down here, because it's stretchy, you have a muscle here that gives you goosebumps. That's the erector pili muscle. I love that name. And it will pull on that hair follicle and cause the hair shaft to become erect, hence its name. Pili means hair, and erector pili, and that will give you goosebumps. You have smooth muscle in the blood vessels down here. You have connective in the blood, because connective tissue is blood. You have fat down here, which is a connective tissue. You have these nerve. There's Marcinian corpuscles, Merkel's corpuscles. You don't have to know them. but they sense pressure, temperature, um, things like that with the nerve. And then you have, I'm trying to look around here, you have the sebum gland. There's some cuboidal in here. This is allowing oils to come up. Here's a sweat gland. There's some cuboidal cells, which are epithelial there. So we've covered nerve, right? Nerve, connective, connective, smooth muscle, skeletal muscle, epithelial.